What are we doing? We are getting healthcare done. Welcome. My name is Nicole Christensen. I'm a board-certified patient advocate, the owner of Care Answered, which provides patient advocacy and care coordination, as well as the title of this show. I am an author of the best-selling book From Crisis to Calm, as well as the founder of Answers for Care, which is a one-stop shop for aging care solutions, where we have everything from transportation to elder law to move managers to home care and everything in between. What we're talking about today is really, what is a patient advocate? What are some of the common questions I get as a board-certified patient advocate at Care Answered, so that we can help you know even more and empower you. So Care Answered's mission is to access the best care for our clients while giving loved ones peace of mind and empowering all patients. And we're all patients. So let me just start with my grateful. I'm so grateful that you're here with me right now to share this information. And I love to hear from you, from some things that are on your mind, so that we can really tackle those topics that are of most interest to you. But in that vein, let me tell you some of the things that I get most frequently, or at least most recently. So some of the common questions is, I am now in a position of caring for a loved one that I did not expect, and I'm barely taking care of myself. That may sound familiar to you. I know it sounds familiar to me. We have our ups and downs when we're taking care of ourselves. And so one of the things that I tell people, even when they're just calling in and asking questions like that, it's the first thing that you need to do is take care of yourself. And what that means can be very different. But the statistics say, and I say this frequently, that those who are providing care often get sick and are more ill than the person that they're taking care of because of that stress, because of not taking care of yourself. So find those things that bring you joy or that fill up your cup so that you can be able to care for others. It's the person that you're with your whole life is you. So take care of yourself. And it's likely going to be that you're going to have to take care of an adult at some point. Again, the statistics don't lie. And I'm not talking only about if you have children or young people that you're raising. It's also about adults. You're likely going to have some care in an adult in your life. And so making sure you first take care of yourself is essential. And how we can prepare for taking care of ourselves and taking care of our loved ones is something that I go on and on about. So if you've heard me before, I am so sorry, but it needs to be repeated many, many, many times. And that's called a healthcare proxy. And what that is you are selecting someone to make your healthcare decisions when you are not able to. That starts at age 18. So for those of you that have children, they're 18 years old, they're considered an adult as far as healthcare is concerned. So if they are off in college, if they're working near home, if they're far away, either way, God forbid something happens to them and they're not conscious, they are not going to call their parents or the person who would be their healthcare proxy if there's not a healthcare proxy in place, because you don't have any rights if there's no healthcare proxy in place. So please, if you don't have one, Make sure that's on your list of things to do, and please get it done. And what's so important is that conversation of what you would have done if you are in a state that you don't have capacity. So it means that person needs to know your medications. They need to know your diagnosis. You need to be able to trust them with that information, because quickly something can happen. And if they don't have that information, they're not speaking for you. They don't have the information. And that lack of information can really be detrimental to your health and your well-being. So having those conversations are just as important as the document itself. A healthcare proxy in New York requires you to select a person and have 2 witnesses. Those witnesses are just saying that you, or let's take me, Nicole is indeed selecting this person to be her healthcare proxy. That's all that's needed. You can utilize Care Answered. We can help you through it, but that is what the basics of what's needed. But that conversation is essential, and that ongoing communication is essential. So that's one of those things that when they say, I can barely take care of myself, or I'm not taking care of myself, make sure you get that done for yourself. And then also make sure that's done for those you love around you that you would potentially like to be the healthcare proxy for. So I had a question not too long ago, and I get it repeatedly. When somebody is in the hospital and they're trying to figure out what is next. Now, as a patient advocate, Care Answered works primarily with older adults and their families, but we've had the experience of working with adults in general, and sometimes when it comes to appealing insurance, with babies and young children. But with keeping older adults in mind, because again, this is the most common things I hear, they have somebody in the hospital and they don't feel like that person's ready to come home. We don't have the things in place. Or potentially they're in a skilled nursing facility short term. So they're getting their physical therapy and occupational therapy, potentially speech therapy, and they're talking about being discharged. And that family says, what are we going to do? I don't understand what we're going to do. We can't have them home yet. So this is a common question and a common concern. And what you do is you make sure that you request and are present for a care plan meeting. So again, one of those things I say a lot is we plan discharge upon admission. We should always be thinking about discharge and what that's going to look like. So if you have concerns that they're not at their baseline, baseline means how they were before they were hospitalized, that then got them in the hospital, or then that got them into a skilled nursing facility. So nobody knows their baseline other than their loved ones or themselves, if they can articulate that. Because when the hospital saw them, potentially they were unconscious. That's the first time they saw them. When a rehab saw them for short-term rehab, they came from a hospital. So they were probably weaker or in less physical condition than they were before they were hospitalized. So articulating and making sure that the folks that are discharging are fully aware of their baseline is very helpful, because it then tells you, okay, first of all, can we get them closer to their baseline? Secondly, if this is as far as they can get and it's not their baseline, we're going to need different equipment, different things in place. And what is that going to look like? So ask those questions, or get an advocate to help you through this. It is not easy. If you are the patient, you got a lot going on. If you're the loved ones, you have just as much going on. That's your person. Those are your people. It's very stressful to try to figure out what to do. So make sure you get answers to all of your questions so that they can have a safe and appropriate discharge. Maybe that discharge is, again, to a skilled nursing facility for short-term rehab. Maybe it's home. Maybe it's an assisted living. Maybe it's home with absolutely different care in place. And who's going to provide that? And how is that going to be covered? That's what a patient advocate can do to make sure all of those things are in place. We are part of a care team. I myself am a board certified patient advocate, which is what it means, what it says. It means I'm certified. We have insurance. We go through education all of the time. I'm very interested in education because things in the health world and care world are changing rapidly. So that's something that Care Answers could do. Or if you're being the advocate for your loved one, these are the questions you really need to ask and to get the answers to. And keep asking until you understand it. It's not okay that they understand it. It's not even okay if just your patient advocate understands it. It's got to be that you understand it and that there's help there. There's resources there to get all of that care in place. It's also real hard when you don't know everything that's going on. So again, talking about discharge, I've had clients that go into a hospital, they have a diagnosis of dementia, and they're very agitated. So they might be physically fine, but they're not acting like themselves. Something is not right. And that can be hard to appropriately advocate as a family member for them to be hospitalized. Because oftentimes, if they're not acting like themselves, but there's nothing medically wrong, they may not admit them. They may see them and say, okay, go home. So it's really important that you understand that word baseline and say how different this behavior is and have them evaluated. Let them know that your loved one has dementia, but this is not the usual behaviors and you're very concerned. Also, treatment of those behaviors. Potentially they may be on medication already for the symptoms that they're showing of agitation or not being able to sleep. If they're on those medications, maybe those medications aren't working anymore. We're all changing, our bodies are changing all the time. So maybe those medications aren't working anymore. Maybe, again, talking to their doctor first before hospitalization is always helpful. So their neurologist, to see, is there something else that we can do? Is there a dosage that we need more of? Is there a dosage we need less of? Is there something we need to stop altogether and then have something else in place? What is the safest thing to do? Sometimes in a hospital, especially if they have any kind of specific area for dementia or geriatric care, because that geriatric care is going to be super helpful because that's very different than somebody having behaviors that is a young person. So we want to make sure that we have an understanding of where they are going. A patient advocate can help with that. But again, asking those questions, talking to the doctor, because they're a resource in themselves, about what the best thing to do, and not when it's a crisis. Maybe you see something beforehand that seems a little off. Make that appointment with your doctor. But again, going back to common questions of somebody that's showing agitation and has dementia, ask the questions, see what resources they have. Make sure they're being safely discharged. Maybe it's not a time to go home, but you have to advocate, and Care Answered can certainly help. Welcome to Care Answered. My name is Nicole Christensen, and we're going to be talking about some of the questions that I get most frequently or most recently. So another one is hospice and palliative care. A lot of people are afraid of hospice. I've heard, well, we're not giving up yet. I've heard, well, we're not ready for that discussion. Hospice is such a valuable resource. And let me tell you a little bit about it and potentially what it's not. So there's palliative care, which you may be familiar with, and there's hospice care. So palliative care is one thing. So hospice is palliative care, but not all palliative care is hospice. So I say that everything should be palliative care because what they're taking in mind is your quality of life and comfort. So with palliative care, you could be still receiving treatment for whatever the diagnosis is. So, for example, if you have a cancer diagnosis and you're receiving chemotherapy, you could still be receiving palliative care. Hospice care is again interested in comfort of the patient, but hospice care is for those that have a prognosis of 6 months or less to live. There are many people that continue in hospice because they've lived longer than that 6 months. Nobody has a crystal ball. We have estimates, but we don't know. The doctors don't know. So in this time, if you're not receiving treatment for your care, but you want to make sure that you're comfortable and you have the quality of life that you want, then hospice is a great conversation to have. It's not like you have the conversation and so therefore it is that. It's a conversation. One of the things people don't know also is you don't need somebody else to refer you to hospice. You can refer yourself to hospice, or a loved one can help refer you to hospice. It doesn't require a doctor to do it. So, what does hospice actually give? I think people are often think about it as pain medication, which is definitely true. There's sometimes that people are in such dire pain, and because our hospital system and medical system is what it is, they are wary to give the level of medication to somebody that is not on hospice. So that might be something that you think of, that, the general medications wouldn't be helpful, but potentially morphine would. And again, doctors are not necessarily inclined to give that level of medication to somebody that is not on hospice. That doesn't mean it can't be done. But in my experience, when people need that level of medication, hospitals and skilled nursing facilities are reticent to give it unless they're a hospice patient. But there are so many other things that make hospice such a value. They have a nurse that comes. A doctor, if you have hospice at home, comes to you. Most people that are in that predicament are not interested in spending what's left of their lives going back and forth to hospitals. So that way it can be very comforting. They also have social workers on staff that come to check in on you. They also have bereavement and all sorts of care for the patient as well as the family. Again, lots of resources at this end of life time. So many times I hear folks getting hospice and then they have died the next day. That is a shame because hospice gives so much, and you could have had that comfort care for a longer period of time. Again, when you're thinking about it or when you want to utilize it is always up to you. I just want everyone to know that it is a resource out there, and to find out more about it could be helpful to you. Don't shun it. Find out more. The other thing about hospice is people think, oh, I can have hospice at home and they will give me aid care, meaning somebody to help with activities of daily living, to make sure that they're nice and clean and have good surroundings. They will likely give some limited hours, but likely not the number of hours that you need. So know that if you're doing hospice at home, which again is a great service, know that you may need more care in the home. Maybe it's from family. Maybe it's paid care with an agency that knows how to do hospice care, or comfortable doing that, or trained in doing that, besides whatever comes directly from hospice. So know that that is a thing. Not saying that then don't do it, but it's really good to be informed, because some people that do have hospice think, okay, they're going to give me all of the hours. Not necessarily all the hours that you would like. Then there's hospice facilities. Many hospice beds that are in potentially a skilled nursing facility or a nursing home, they're kind of those beds belong to a hospice company or provider. So that can be done, or there are just spaces that just do hospice. And that is generally for people whose prognosis is even shorter. It could be they're thinking that the person has only weeks to live. Again, that can be a great asset to people. They have the comfort there. They have much more one-on-one care. They're really interested in the quality of life that you have. So it's different from a skilled nursing facility or a nursing home. It's going to be a different level of care, even if it is in a nursing home. So again, knowing these options, knowing what they truly are, is so helpful for people. There are options out there, and I want you to know you can access them. So the other question that I get a lot is in regard to short-term care in a skilled nursing home or skilled nursing facility or rehab. Again, that's where you get physical therapy and occupational therapy, as well as potentially speech therapy and whatever your skilled nursing need might be for a short period of time. A lot of people think, okay, I have Medicare, a supplemental to Medicare, because there's Medicare Advantage and then there's Medicare supplemental. And I've heard that they cover 100 days. What people sometimes misunderstand is it doesn't necessarily mean you will get 100 days. And I go back to saying we talk about discharge upon admission, right? So we don't want to use up our 100 days just to stay there. Most people want to go back home or wherever their home is going to be. So we want to use it to get to the baseline that I talked about. Again, the baseline before you got into a position that you were hospitalized and then needed short-term rehab. We want to get as close to that as possible. And insurance is only going to pay for that till you reach your baseline or you've leveled out, meaning you're not going to gain anything from more therapy in this setting. So just because you can get up to 100 days doesn't mean you will actually get 100 days. And you also don't want to necessarily use your 100 days because that's how much you're given a year, right? So if you needed it another time, you may not have the days available. So know that that is true as well. So what you're really trying to do is be discharged with all the capabilities that you could possibly get in that kind of setting, meaning getting to your baseline or as close to it as they feel is possible. That is what the insurance is going to be looking at. They are going to be in contact with the skilled nursing facility to see how the therapies are going. Okay? So it's really important to think about that. I had another question in the same vein in regard to what if you still have a skilled nursing need, right? So your therapies are done, but you have wounds that need constant care. That may or may not be appropriate for you to stay longer than just the therapy level in a skilled nursing facility. But if you've reached your 100 days, it will likely not bring about the other more days beyond the 100 to be covered by insurance, because Medicare is not long-term care. Now, I have, as a patient advocate, got around that, and there's different ways to get the services that you need. But it's not cut and dry. It's not 100 days. So you can certainly contact us, but always ask the questions if you're advocating for yourself. Ask the questions. Tell them about the baseline. Have those care plan meetings. Know what you might need to have in place and what rights you have via your insurance. Also, know your insurance. This is for anybody, Medicare or not. Whatever kind of insurance you have, nobody likes to be surprised with bills. So know your insurance. Take that time to call when you don't understand it. None of it is clear and easy. I'd love to say, oh, you know, some insurance companies make it so easy. Oftentimes they don't. There's all sorts of languages, co-pays, deductibles, co-pays, insurance, co-insurance. So you have to kind of know these basics of what that means, and then ask questions if you don't understand. If it's your HR and you're working and that's where you're getting your insurance, you can ask them. They may ask you to call the insurance company yourself, and I would suggest you do so, because then it's from the horse's mouth, and look for it in writing, like everything, so that you know that that is absolutely true. And if you don't understand a bill, ask. Look at your explanation of benefits so that you know what's going on. But again, these are the common questions I hear and that we're able to answer at Care Answered based on your specific individual issues and concerns. But know that it's not cut and dry. Going back to what I said before regarding short-term care in a skilled nursing facility. It is not necessarily 100 days, or it's not necessarily 20 days. It depends on what insurance you have, as well as the progress that you're making and the skilled care that you might need. So again, reach out to me at Nicole@careanswered.com if you have other questions. We do this to empower all patients. We want you to have the information that you need to access your best care. Thanks so much for joining us. We'll see you next time.